So you're 65 or older, or you're under the age of 65 but with a disability. You're on Medicare or Medicaid. There are some other plans that you need. You may not necessarily know what they are, but well, that's why we brought Danielle Polk in here to tell us exactly what it is. She's a community outreach representative for United Healthcare. How are you? It's good to see you again.
Good to see you as well.
Of course, we have you in here every year to talk about some of the different things, and tell us exactly what United Healthcare is all about.
United Healthcare is a company that's been around for over 40 years. Our mission is to help persons live healthier lives. We offer commercial plans, we have Medicaid, and we also have a Medicare Advantage plan, which is for persons that are 65 or older, or persons who are disabled that have both Medicare and Medicaid.
And it's called the Dual Complete.
Dual Complete.
Okay. Now, I just turned 63 here recently, so here in a couple more years, I will automatically get on Medicare. But still working here, I'll have that insurance as well.
Right.
So I'll be fine.
Right.
But once I leave here and decide to finally retire, I do need to pick up some other plans that Medicare, some things that Medicare doesn't cover. Correct?
Right. Part B, which is your provider coverage, and Part D, which is your prescription coverage.
Okay, so the Dual Complete offers coverage over and above what is offered in Medicare and Medicaid.
Right.
So talk about some of the things that the additional coverage includes.
We have $2,500 in dental, which covers dentures, root canals, periodontics, fillings, cleanings, x-rays.
Is that $2,500 a year?
It's $2,500 a year.
Okay.
And that's only the work portion. The preventative part, the cleanings and the x-rays are the preventative portion. So the $2,500 doesn't kick in until you start having your work done.
Gotcha, gotcha. So if you go into just get your teeth cleaned or get x-rays or something like that, you have to cover that yourself.
That's a no-cost copay.
Okay, oh.
And so once you start having your services done, that's when the $2,500 comes in.
Ah.
And so there's still no cost copay at that one, with that one as well.
That's good.
It is good.
That's very good. Vision coverage.
Vision.
Which is important for those of us that are getting older, because that vision starts to go.
It does, it does. We offer $250, so if you wear contacts or if you wear glasses, you're able to get your contacts or your glasses with the $250.
Now what about the checkups though?
The checkups are your preventative.
Okay.
So that cost does not come into play until you get your glasses, when you select your glasses or either your contacts. That's where the $250 comes in, and still at a no-cost copay.
Transportation to and from the doctor?
Yes, we offer 36 visits a year to the hospital.
36?
36 visits.
That's a lot of visits, Danielle.
It is. That's to the hospital, to the doctor, to the pharmacy.
I'm lucky if I go twice a year.
Right, I know. So what happens is, if they need transportation to and from, that counts as 2 visits. So, if they're needing transportation one way or round trip, they just make a phone call to customer service and they'll set up their transportation.
So the trip there is 1 and the trip home is 2?
Yes.
Okay, gotcha. Talk about pharmacy benefits.
Pharmacy benefits. We have a formulary, of course, and so our members, if they qualify for our product, they'll never pay anything more than $8 and some change, or nothing less than $2 and some change. That's where our copays actually come into play with our prescription coverage.
I'm sitting here stunned listening to this thinking, 65, hurry up and get here, because that's better than the insurance that I have right now.
It is.
I mean, that's wow. Hospital coverage. Talk about that.
Coverage. We do have hospital coverage with Medicare. Part A, that's your hospitalization. Your Part B is your provider services. So with our particular plan, the United Healthcare portion, you just show your card and your Medicaid card, and then when you're admitted into the hospital, you're admitted and there's no copays and no deductibles, because that's covered under our plan.
Okay, and then whatever charges that you get while you're there, is that covered as well?
Yes. So basically, when you go into the hospital, all your charges are going to be covered, and you walk out with no costs, no copays, no deductibles. But you have to have Medicare and Medicaid.
Right, exactly.
Right.
Medicare and Medicaid, and again, you've got to be 65 or older, or or have a disability if you're under the age of 65.
Right.
Talk about the over-the-counter products that people are able to order.
Our over-the-counter catalog consists of toothpaste, toothbrushes, blood pressure cuffs, incontinence products, some canes. We have scales, just an array of items. So every 3 months, our members get $225, and they're able to go into that catalog and make those purchases. And what happens is if they don't use all of those funds that we provide, then it rolls over into the next 3 months.
That's nice.
So if they wait until December, then they'll have $900 to spend on those items.
Wow. That's when it's Christmas time.
Right.
Chiropractic Services, talk about that.
Chiropractic care, we offer 10 visits a year. So if they are getting basic coverage, basic chiropractic care, then they're able to use those 10 visits at no cost, no copay.
And podiatry, feet?
Podiatry, we have 4 of those a year. And so persons that have diabetes, they should not be cutting their toenails. And that's what the podiatrist is for. They can go in and get their toenails cut, or if they're having issues with their feet, then they're able to go to a podiatrist and have services done, no cost, no copay.
Wow. You know, a little mani-pedi thing going on there.
Right, right.
Now, this dual complete product that you offer, it's offered in 23 counties in the state of Mississippi.
Right.
And I would assume that's the coastal counties are included in that?
Yes. The coastal counties that are covered are Harrison, Jackson, Hancock, Stone, George, and Marion County. And January 1 will add more counties.
Wonderful, wonderful. And of course, if you want some more information about it, about United Healthcare's Dual Complete Plan, the number's on your screen, 866-263-1164 is the number. And also, there's a great deal of information on the website, which is also there on your screen, under www.uhccommunityplan.com, which is UnitedHealthcareCommunityPlan.com. And are there different levels of the dual complete plan that you can purchase, or?
No, and it's actually a no-cost premium. So basically, it's just that one plan, but you just have to have Medicare and Medicaid. We really have to push that so persons understand that you have to have those to qualify for that. And it's just that one level that we're offering at this time.
Wow, that's awesome.
It is.
I'm again sitting here, okay, 65, get here.
Right, right.
I'll be better off with those health plans. Well, thank you so much, Danielle, for being here.
Thank you.
And there's some great information for you. Again, if you're 65 or older, or you have are under the age of 65 with a disability, and are eligible for both Medicare and Medicaid, you need to give them a call. Numbers on your screen at United Healthcare here in South Mississippi.
Thank
Danielle,
you.
so good to see you again.
Good seeing you as well.
Thank you for being here.
Thank you.